Hi everyone, my name's Kaylee. I am an occupational therapy doctoral student from the University of North Dakota, and I'm completing my capstone project on chronic upper extremity pain and ways that you can self-manage that from home. For today's video, I'm going to be talking about cryotherapy, also known as cold therapy or icing. So cold therapy works by conducting heat out of your body by using some sort of cooling agent. It constricts your blood vessels to the area, which helps decrease swelling, and it's also going to help decrease pain. So lots of different ways to ice here, but let's start with this one actually. So very standard ice pack here, just came from Walgreens. This one has a little bit of a barrier to it already, so it's not super cold, but you're just gonna wanna put that wherever you're having the pain and holding it there. Pretty simple. You can also make homemade ones, like this one. It's just a plastic bag with some ice in it. This one does not have any barrier to it, so you would want to use a barrier for your skin. So just a thin sheet, a thin towel like this one, and then putting it there. You can also use any frozen fruit or vegetables. I just had frozen mangoes in the freezer, but putting it wherever that pain is as well, like that. You can also use a towel, another towel, to tie it around, and then that way it'll stay there as well. You don't have to hold it. This one here also came from Walgreens, but this one works really well if you're trying to find, like, localize a spot. So let's say you have like carpal tunnel, you can just put it right over that area and then wrap it around like so. This way you can kind of go about your day, you're getting it iced, you can move around, you can still do everything, and it's still getting the benefits of the icing. So that is another option. If you have pain specifically in the hand and you're trying to target that area, an ice bath works really well. So it's just cold water, a couple ice cubes, and then sticking your hand just right in that water. So that's just another option there. With all of these that I just mentioned, you're gonna wanna stay within a 10 to 15 minute range for that. Anything after 15 minutes, your blood vessels actually begin to dilate, which is gonna cause the opposite effect. So you don't want that, so really just try to be mindful, maybe set a timer for that 10 to 15 minute range there. Last one I wanna talk about today is ice massage. So if you have like a Dixie cup, put water in it, freeze it, and then cut it down, just rip it off. So a little bit of ice is showing, and you can really get that area. So if you have lateral epicondylitis, really getting in that area, just right around the bone, wherever the pain is, there. This one, since you are doing it to a smaller area and you're putting that ice directly on your skin, you're only gonna do it for 5 to 10 minutes. Burning and aching feeling is normal. However, when you start to feel numb, that's when you should stop. With any of these two, once you start feeling numb, that's kind of the indication to stop. And if you do have any diseases, Raynaud's disease, history of vascular disorders or diseases, any sensory disorders that's going to impact your ability to feel temperature, all of these are things you should not do, or be mindful of doing them so that you're not getting frostbite at all. Lastly, with all of these, it is normal for your skin to turn red, light red or pink. However, if they turn like a darker red or white, gray, or yellow, or develop welts, all of these should be stopped immediately. That's kind of an indication that you might be getting frostbite. So just really be mindful, listening to your body, always checking, checking every 5 minutes just to make sure that your skin isn't turning one of those colors and not getting frostbite. So thank you.